Hello, everybody. Good morning, good afternoon, good evening, wherever you're joining from. This is IRS Group, and my name is Milen Jacob, and I'm happy to have you on this All Star Live session. If you are able to follow me, listen to me, make sure you comment where you're joining from, your name, and the country you're joining from, so that we can have a great, wonderful session today. Right. So today we'll be looking at writing, OET writing, and we'll be demystifying the purpose, the concept of the purpose, which is pretty distracting or confusing for some candidates. And I have got 9 sample introductions lined up for you as we go on. So hit the chat button and let me know where you're joining from. This is going to be a great session. I'm just looking for your live feed as we are already live, and here we go. Just reading your comments. Hello Chinnu, the great trainer, good to see you. Abha Bali from India, hello everybody. Yeah, good to see that all of you are able to attend. Kayla from Turang, Hira from India, Divya from India, Mohammed, good afternoon. Melvina, hello, good to see everybody. I'd also like to know if you have an upcoming OET test date. Hello, Neetu Shibu, Auntie Bill from Botswana, Dan from the Kingdom of Saudi Arabia, Mercy, hello from Zambia, Shonika from Fiji, hello. Hey there. Great. Tatiana from the UK, hello, Donna from Saudi Arabia, Ina from Ukraine, lots of love to your country, going through a tough time. Fawad from Pakistan, hello, Annie Jacob, the great OET trainer again. They're good to have all my team out there. Hello, Asha. Hello, Saji Anthony. Hello, Sidra, Fawad from Pakistan, Firat from Ghana, Yuvarabba from Ghana again, Lisa from Japan. Hello, so many. Good to see you. Gay from Philippines, Fred. Your test date is on the 6th. All right. Good luck for your test, and I hope what we do today will be helpful. Hello, Kwangkumoy. Sorry if I mispronounce your name, from Thailand. Good to see you. Alexia has a test on the 23rd of April. Dr. Skakra from Algeria. Guy from Philippines. Gulam from Pakistan. Sanu has a test on May 8th. Nalinia from Kenya. Chinye from Germany. Hello, everybody. I'm sorry I can't read all the names. Hello, Pavadi from my home state of Kerala. Good to see you there. So today we are going to look at the purpose of OET writing and how can you convey the purpose better and score higher. This is what we are going to do today, and I hope it's going to be a great session. So I have a few questions lined up for you. There would be a lot of questions and you will be answering me, and in the process we'll be learning what we have to learn today. So here comes your first question on the screen. I'm sorry I can't read all your names as we need to get started, but I'll definitely go through your names as we proceed or later. And thank you so much for joining. And if you really think that this session is going to help you or your friends or colleagues, don't forget to share this right now. Yeah, so can you answer this question? Do you clearly state the purpose purpose of your letter when you're writing? How clearly do you state it? Are you good at it? That's what I want to know first. Do you clearly state the purpose? Type in yes. Oh no, you have two dice on the screen, and the answers are going to be of great help. Just waiting for your answers to pour in. Are you used to clearly stating the purpose when you write? Is it something you're good at? Ina says yes. Excellent. Good to know that all of you do state it clearly. So sometimes confused. That's what Geeta says. Sure, Geeta, by the end of this session, we'll be over with those confusions, and Tintu says sometimes. Right. So for those who have some confusions or who are not regularly used to clearly stating it, yeah, Jel Kensek also says sometimes yes, sometimes no. So I want it to be an absolute no after this session. Let's look at how you can do that. Now, clearly written purpose is an essential part of a formal letter. An OET letter is a formal letter. So as a formal letter, make sure that your purpose is clearly written. And it should come at the beginning. Of course, in the OET's context, we will definitely be giving further details later. But having said that, the purpose should, be mentioned in the introduction. So that's what I'm pointing to. So again, Mahiyet says yes, but have some difficulties sometimes. Excellent. So you're welcome, Geeta, Roop, good evening. Lina again joins from Zimbabwe. I'm sorry I can't read all your names again, but this is going to be a lively session. And here's the second question for you on the screen. Would all letters have a similar purpose? Do you think that all letters have a similar purpose? If you have been preparing or practicing for OET for quite a long time, you would have written a lot of letters, and I'm asking if all those look similar. Hello, Marina. Good evening. Shibin says yes. Anu says no. I have more no's, which is a good thing. All letters should not look alike. Here we go. Yes, I agree with you, Shibin. We'll discuss that as we go. So, the purpose of each letter will be unique and different from that of other letters. Now, that is something which you have to really master and learn. And sometimes you might get a tendency to use similar purposes or stock phrases across the board, and that might lead to lower scores. If you use something similar for all the letters, that is indicating that you have not understood the unique features of the case notes, the question you have for the day, and that is big trouble. So we'll be looking at the marks you could potentially score and how you can score the highest mark for purpose. So that's coming up in a short while. Again, another question for you to help you hone in to the purpose. What reasons would OET letters be typically written for? What that means is what are the different reasons or various purpose that you can think of that would come in a typical OET writing context. Think of the various reasons for which you'd be writing an OET letter in the first place. Doesn't matter whether you're a nurse, a doctor, or whatever health professional you are, a pharmacist or a physiotherapist. Doesn't matter. All of you do have a reason for writing, and what is that reason, or what are the different reasons that you can think of? Sheen, Janet, and they say it's referral. Betsy says future care. Janet says discharge. Anu Vajracharya says referring, discharge, and transfer. Janet, transfer of care. Jitu says referral, discharge, transfer. It's a lot of okay. Could be a referral, discharge, or transfer. Mallet. Kwan Komo says referral, transfer, discharge, summary for further care. Yeah. And BG, clear communication, continuation of care. That's Joe Ramos. Patumi says referral, discharge, and transfer. Mil B. Anthony, referral. Geeta says further care. Mercy, admission, referral, discharge, transfer. Muhammad, referral, discharge, transfer. Tintu, transfer, discharge, home visit. Alexia, referral, discharge, transfer. Sansanu, continuing care. Praise, referral, discharge, transfer, further care. Simi and Raj, discharge, transfer, referral. Milby, discharge. Referral, Chantel, that's Chantel. San says further care. Sheenat says referral, rehabilitation. Not going to repeat referral, discharge, and transfer. Annie Jacob says home visit for wound dressing, monitoring of medication, excellent. Abba says letter to known and unknown, yeah. Sheenat says continued care, okay. Shantes, further management, that is step down facility. Again, the three major reasons. Muhammad, yes. Tinu, Reni, Nobi, continuity of care. Brilliant. So I'm really happy with what you have come up, and I have some on the screen for you now. Mostly the points which you have already mentioned, which is absolutely brilliant. Good to know that many of you have a clear idea. And so you can have a quick look at these. So you could be writing for the management of a particular condition of a patient. It could be a referral. You could be writing for assessment or further assessment for post-discharge care, to update, continued care, monitoring. Abba says counseling. Cyril Peter says rehabilitation care. Brilliant. So absolutely, these are the usual typical reasons that a referrals would be for. Now we come to the next question. How can you identify the purpose? How do you identify the purpose clearly? Or where do you find it from in an OET writing question? Sorry, you have to do a lot of typing in the chat box, but this is how you learn. Just waiting because of a slight delay for your answers to come across. Yes. Abba says in the writing task, case note at the end of the question, written in discharge paragraph. So that was Milby, Marina, Lisa. Milen says from the task given below. Muhammad says based upon body of case notes, task question from the task, discharge plan. Right. Sansanu says through writing task or discharge plan. Yes. Alexia, it's in the task, in the discharge plan. Patumi says last line of case notes and writing task. Brilliant. So the first place that you have to look for the purpose is the writing task. So you have a writing task on the screen for you. So if you look carefully, you will be able to identify the purpose. You're writing to an orthopedic registrar outlining the patient's condition, and you're requesting surgical intervention. Right. So you're writing to an orthopedic registrar, you're writing to an orthopedician for a surgical intervention, right? So the purpose is to have a surgery done for this patient. And so you would outline the patient's condition briefly and then request a surgical intervention. So the first place you have to look for identifying the purpose is the writing task. And that's the first thing that you should be looking in the first place when you get the question as well. But you should also look for the purpose in the notes. And this is typically, towards the end, you might have the diagnosis or the plan or the discharge plan or the post-operative care plan, whatever. That's where, again, you get a hint. So in this case, we get a little bit more details from the notes, from the end of the notes, the part just above the writing task. So we now know that it's going to be an internal fixation surgery. It's urgent referral. That is important as well. If you're writing an urgent letter, if your letter is urgent, that urgency should be reflected at the beginning of the letter. That means in the introduction, because the urgency of care is part of the purpose. And if you miss it, it could cause problems. Now, when I say this, remember that the reason why you would highlight the purpose is that proper care is given to your patient. And any writing task is like a handover. So in that case, you can't delay an urgent, request for care. And if you were to miss it in the introduction, then that's what might happen. The patient might not get the urgent care that he or she requires, and that could cause a lot of problems clinically. So that's very important as well. All right. So as I've told you today, it's a lot of questions for you, and here's perhaps one of the final questions before we move on to the introduction samples. How can you score higher on the purpose? You know that it's 3 marks. Abba Bali is asking, in urgent letter, we should write first recent date, today's, write first recent date, today's date, right? So now, okay. I will answer that question, although it's out of today's topic scope. Now, if you're writing an urgent letter, you would ideally mention the urgent requirement first, immediately after the introduction. In the introduction, you will mention that this is an urgent transfer or request or whatever. And then once you have done with the introduction, you will start with the most recent visit. Absolutely. I hope that's what you have been asking me. That's right. 3 marks, yes. I see. So to score higher on purpose, you should actually meet what the assessment criteria and level descriptors ask you to do. Now, this is an extract from the official public version of the assessment criteria, which is available on OET's website. It's out there for everyone to download and study. Now, what you see here is that, now the purpose carries only 3 marks, but those 3 marks are crucial. Any mark would be crucial for that matter. Sorry. Okay. San says read case notes carefully. Absolutely. Right. I'm seeing some responses for the previous question. So what does the criteria tell you? Purpose of the document is immediately apparent and sufficiently expanded as required. Uh, so you have to look at these two aspects, and if these two aspects are met, you're going to score high. And I want you to target the full marks for purpose, which is 3 marks. Sure. So remember, the purpose of the document is immediately apparent and sufficiently expanded. We look at now how you can convey this. You have to convey it immediately, and then later you have to expand with further details. So how can you convey the purpose? Once we learn how we can do that, we have looked at the various aspects, and now we have reached that stage where you're looking at precisely how can the purpose be communicated to the reader. Your understanding of the purpose is well enough, but if you're unable to convey that as required or as expected, then it doesn't help you much either. So let's look at how you can convey the purpose. Can you type in how you would convey? What words would you use to convey the purpose precisely? If you can really, nail it with those specific group of words which would convey the purpose, that's going to be really, really awesome. I would say this is one of the last questions I have for you, and then I'll go on showing you some sample introductions and how the purpose has been conveyed in those different samples. 9 samples have been lined up for you. And BG says it should be clear and concise. Yes, but how would you convey that clearly and concisely? That's my question. It should be clear and concise, absolutely. We've been looking at the criteria, which again says immediately apparent and sufficiently expanded, and it should be done clearly, definitely. Okay, so Anu is giving an example. Thank you for seeing. All right, so what does that mean? I hope you mean using such phrases. Okay. All right. So I see the examples such as, thank you for seeing, Mrs. Jackson, that's praise. San says indicate the purpose of writing at the beginning of the letter according to type of letter and requirement. Yes. Thank you for accepting. So I'm writing to, yes. I'm writing to refer, that's Cassie. I'm writing to refer, okay, I'm writing to urgently refer, yeah. So what you're actually doing is you giving me examples of how you would use those verbs appropriately. Right. So you can use appropriate verbs to indicate the purpose. Excellent. So I've got a list of common verbs that you can use to convey the purpose. So you've got refer, transfer, discharge, which are the most commonly used types of letters, actually, especially for nurses and doctors. Right. So, and then you can use other verbs such as update, see, accept, request, introduce, provide, recommend. A whole lot. Now, this is not an exhaustive list. You can definitely use other verbs as well to convey your purpose. Okay, I see a lot of examples with I'm writing to refer. Now, should you always write I'm writing to refer? I would rather disagree. You don't always have to start with I'm writing to refer. So the 9 examples will be an eye opener to how else you can write the introduction without having to always use I'm writing to refer. Now, it could be a problem if you use I'm writing to refer for a letter which is not a referral letter at all. That could be a problem as well. So uh, I I wouldn't keep you waiting too much before we jump into the introduction. So I have 9 patients or scenarios or situations with snippets from the case notes and then a sample introduction. But if you have questions, you can ask me as I show you those introductions as well. Here we go. Excuse me if there are some typos while the slides have been made. So you have a patient called, I suppose, Mr. Randolph Jones. All right. So you have made a diagnosis of, it's a query actually. You suspect the patient to have depression. And you're writing to a psychiatrist. Right. How would your introduction paragraph be like? Group Sony says the purpose of this letter is to, okay. I don't think you have to mention that the purpose of this letter is this. You will be definitely highlighting the purpose, but you don't have to say that this is the purpose. Okay. So I'm having answers from Roop, Sony. Sansana says I'm writing to transfer Mr. I'm sorry, San, there is no hint that this is a transfer. Bindu Nair says it's if it's a discharge letter, can we write? I'm writing to refer. Not really, Bindu. If you're not referring, then you cannot write that. Shibin says he's suspected to have depression. Bishoy Ball says I'm writing with regard to Randolph, who has been suffering from symptoms of depression. Your further management and assessment, would be highly valued. Okay. Okay, I have a problem with that. Further management and assessment, actually, the request is for a further investigation. Management is not requested. Sulfacure, I'm writing to refer Mr. Jules, who is having mood swings for your further management. Okay. Further investigation. So that's Milby, I think, yes. Janet says, at 10, yeah, that's fine, Sam, that's fine. I'm sorry because of a lot of answers popping in. I'm not able to catch up. Praise, Geeta, Mercy, Saji Anthony. Okay, when will I take a class on the first body pattern? I will mention it definitely. So I've got a sample for you. So I'm referring Mr. Randolph Jones to you for further investigation. He presented today with signs indicative of depression. I wouldn't say that this is the only way you can write. You can write in different ways. But ideally, if you could mention the patient's full name and the reason which is the purpose. Very briefly, that would be ideal. So it's clear that you are referring, and this is the patient, and you need further investigations for, so he presented today with signs indicative of depression. So you suspect a depression. Rup is asking, is it wrong if we write further management along with urgent assessment? If further management is required, yes, definitely. But sometimes, so I've told that earlier, don't use fixed phrases. So it's usual, I usually see among many candidates that you always write the same thing, further management and assessment. Now, sometimes, what is to be managed may not be mentioned. So that might be too vague. Management of what? If you have a particular patient, you can manage different aspects of the patient. You can are you going to manage the patient's pain levels, or different things can be managed. So that becomes too abstract and not concrete what you are going to manage. So that's what happens when you use fixed expressions in all your introductions, and that's not the right way to achieve higher score. Excellent. So let's now jump into the next patient. I hope the first one was okay with you. So you have another patient. Her name is Mary Tilda. She has past medical history of respiratory infections multiple times, breathing distress, high-grade fever, X-ray consolidations in lung, possible right lobar pneumonia. Okay. So you're writing a letter of referral to a respiratory physician, requesting further investigation to confirm the diagnosis. All right. Think of your introduction for this letter. Saji Anthony, I'll give you our contact number, and you can ask one of our student counselors to be in touch with me. Thank you. Thank you for seeing Mr. X. All right. I'll check it out later. I'm not able to see the whole response. So think how your introduction for this second sample would be like. Sharon says, I'm writing to introduce Miss Mary Tilda, who has multiple chest infections. Would require further investigations for a definitive diagnosis. All right. Sheenath Williams, I'm writing to introduce Ms. Mary Tilda, who requires your expertise assessment to confirm her diagnosis. Well, Sheenath, you should be mentioning, what you suspect before requesting a confirmation of the diagnosis, and the usage expertise, whatever was not appropriate, I'm afraid. Sanu says, I'm writing to refer Ms. Mary Tilda, who requires further investigation owing to suspected right lower pneumonia. Right. Bishoy, I'm referring Ms. Tilda, who has multiple respiratory infections. Jamal, I'm writing to refer Ms. Tilda, whose signs and symptoms are suggestive of. Yep. Shibin, I'm writing to refer Miss Mary, who requires further investigation for a concrete diagnosis. Marina Hassini, Uswad Shali, Ruby MH, thank you for seeing Miss Tida. Requires further investigations, right. She presented with a high fever and breathing distress. Now, because you have a query given a suspected, diagnosis or a provisional diagnosis, that can be mentioned. What the provisional diagnosis could be ideally mentioned in the introduction itself. That would give a bit more clarity for the purpose. Tintu Thomas, I'm writing to refer Miss Mary, who is suspected to have right lower lobe pneumonia. Geeta, right. Janet, Sarah, Naveen, and Anuan. Okay. Most of you have written very good introductions, so I'm happy with it. Here's an example for you on the screen. Thank you for seeing Miss Mary Tilda, 39-year-old patient with possible right lower lobe pneumonia for further assessment and management. Anu, yes. Saji, I'm writing to refer Ms. Trilla, who is suspected to have for requires further investigation and management, yes. Sade, Joy, good attempt. Okay, so let's move on. Now we have the next patient, Keith Hoppen. You're writing to the manager of a rehab center where this patient is going to be moved to. Ren talks about confirm the diagnosis she presented with the lower pneumonia according shown on her x-ray. Okay, you don't have to go into the test details in the introduction, I'm afraid. Well, Naveen, if it was not requested, then you can omit it. Perhaps, it could have been a typo. If it were mentioned, yes. So now I'm waiting for your sample introductions for this patient, Keith Hoppen. This is slightly different from the first two introductions which we have seen. Fish choice is I'm writing to transfer Mr. Hoppen, who has been diagnosed with acute gastritis for your rehab center. All right. So as I read, I have a sample for you on the screen as well. And this is a typical example of a transfer letter. So the verb transferred is being used as well. Sharon, yes, that's good. Shibin, this letter is to inform you about transfer of Mr. Keith Hoppen, right? I'm happy that many of you have used the word transfer is being transferred, which is a good idea actually to use transfer, which is the appropriate verb to be used in this context. So that shows great learning. Hirani, I'm writing to refer Keith into your care, who was admitted with acute gastritis. He is being discharged, right? Sarah Elhessen, yes. Janet, yeah, that's good. Ren, Sam. Ruby, I'm afraid it's not a referral, so you can avoid writing thank you for seeing. So we use thank you for seeing, which is another way of saying, somebody is being referred, especially when you're referring higher up, like a GP to a consultant, for example. So I wouldn't suggest thank you for seeing in this case. Tintu, Ritu, Vijaya. Okay. Oswald. And Tui says, thank you for accepting to follow up the care is being transferred into your care. All right, yeah. Nika is set to be transferred to your care. Okay. I hope you are learning a bit more from your existing awareness of how to write introductions. And if you really enjoy this, I would request you to like this and share it with your friends or colleagues who might as well like to join us. Sarah is asking, can I ask about the structure of transfer letter, the paragraphs it consists? Sarah, I'm afraid I can't give you a specific rule. There's no specific rule. It depends on the set of case notes that you're going through. So would it be, but typically you might, after the introduction in this case, you would talk about, his admission very briefly. You might summarize and then move on to what is expected of the care home, the care facility, what sort of rehab, whatever is in the plan, the rehab plan details, ongoing medication, and all those things you would perhaps, include in the following paragraph so that it makes, sense, and there is a sequence which is ideal in this case. But having said that, it depends on the set of case notes you have, how you would organize it. So let's look at another patient. Now, today we have Mr. Joe Nair, who had a fall at home. He had a fracture, and you're writing to a social worker. Thank you, Hirani Naveen. Thank you. Colin is asking, thank you for taking over the care. Yeah, definitely. There's nothing wrong with that. Jin Simol, yes, good introduction. Thank you very much, Hirani, for your words of appreciation. Yes. Uh, and I'm not a big fan of typical cliched writings like I'm writing to refer, which might cause problems as well, especially if it's not a referral. So your introduction should be, tailor made and showing the purpose clearly. I'm having some jumbled chat coming up, so perhaps a slight delay, but thank you for your patience as we go through the transmission delays for the live feed to reach you and then your comments to come back to me. But here's my sample for you. Thank you for accepting Mr. Jonah into your care. He underwent an internal fixation surgery for a fracture of the left tibia. Hassini, yes, that's good. Naveen George. So I hope you have no questions about Joe Niles' sample as well. Oh yeah, I'm getting some samples right now. I'm writing to request you to visit Mr. Joe Nair, who has recently underwent ORF surgery for left tibia. Now, I would request you not to use a technical term like ORF, open protection internal fixation, to a social worker, which is about the reader awareness. So when you use abbreviations, make sure that your reader does understand those abbreviations. If not, it might not be appropriate actually. Right. Although that is not absolutely assessed in the criterion of purpose, it's still important that across the letter you don't use abbreviations inappropriately. Do see all your samples. Okay. Moving to recovery after surgery. Shibin, he is being recovered. Okay. If it's mentioned that he's recovering well, perhaps yes. Janet, yes. Praise. Okay. Now we move on to the next patient. All right. The task is, I think, from another. Okay. Okay, it's a to the discharge. It's a letter of discharge, not reference. Sorry, to the GP. Sorry for the typo. So it's a letter of discharge to the patient's GP post the cryosurgery. So this patient had a cervical cryosurgery, and now you're writing a letter of discharge. So I'll jump to the discharge letter. Now, there's something that I want you to learn, especially from back into your care. So, can you tell me why it's relevant back into your care? This is a letter of discharge, and excuse me. So, as I've mentioned, this one was for a GP. And what you can infer is that because it is to the GP, you would expect the GP to continue the care and post-op management once the patient is discharged. So that's exactly what you have to be focusing on. And you don't really have to specifically mention those in the introduction because it is to the GP. Now, you can also use it if it's for someone who has been taking care of the patient earlier, like a nurse who has been routinely visiting, or the manager of a care home where the patient is a resident. Absolutely. Gay, Mercy, yes. Right. Roop Sony, yes, you're right. That's right. Saji, Prashant, yes. Known patient, that's right. Nigeria, Marina, yes. Absolutely. Absolutely. Hirani, yes. Brilliant. If you would like to enroll in a personalized training with IRS Group, please visit irslearning.com and register, and you can be in touch with our student counselors who would advise you for proper training. We have one-on-one sessions which should be tailor-made for your needs. So we'll have a demo session or a placement for you to assess your current, test readiness level, and then you can start training with some of our finest and expert trainers, and make sure that you are ready for OET with a bang. My team of trainers and I do provide correction sessions for you as well. So we'll give you personalized corrections, and we have candidates from across the globe. So make sure you enroll in a fine customized training program. So please note the learning portal number, and you can download from the Google Play Store as well the mobile app, IRS Learning. And you will have a lot of resources coming up in the app as well. So here's the next patient. Just focus on the notes. Right. So it's Mrs. Leah McKenzie, had a bunion surgery, and we are writing for visits from a home nurse. So from the community nurse or a district nurse. And since we are running out of time, I'm just jumping through the other samples, which I had promised, all 9 of them. So this is to introduce Mrs. Leah McKenzie, who requires 1 week of daily home visits following bunion surgery 2 days ago. Now, I have not given you the entire case notes, so you may not get the entire picture, such as the surgery was performed 2 days ago. But still, I want to focus on the fact that, this is another way of introducing, especially to a care provider like a community nurse or maybe a physiotherapist, someone of that sort, absolutely fine. Got a few more samples lined up, and so I'll quickly jump through the samples as we draw to the end of the class. Now, do remember that whatever you have mentioned in the introduction, the finer details, the specifics should be mentioned later in the body paragraph, and that's what would complete the purpose. So immediately apparent is what we are exploring today, but it should be sufficiently expanded in the rest of your letter. That's very important as well. Here we go. So I've got the next patient as well. It's to a physiotherapist. The patient has mobility issues. Milen Ron. Joint pain, osteoarthritis. Let's look at the sample. I'm writing to update you on the progress of your patient. After a week of physiotherapy, she is now able to move independently. So this could be, physiotherapist to another physiotherapist to a GP, writing about what happened after the physiotherapy sessions and so on. That's brilliant. I will indeed go through all your samples. Thank you, Praise, for that, your comments. After today's session, I will be, reading your comments in detail and, making sense of it all. So sometimes you might have to write an advice letter. And nurses and doctors might not have this, but maybe pharmacists or some other professionals, which is really important as well. So here is an example. I'm writing to provide you with the information required for preventing COVID-19 among the residents of the care home. An introduction for maybe an information letter. And let's look at the final sample. So your patient has got memory problems. Mrs. Linda Dubb, forgetting things, confused about meals, early onset dementia, which is a query you're writing to a neurologist. Or, you could be a nurse writing to the GP, it's fine. Different contexts. On my visit to her home, Ms. Linda Dubb was observed to be confused. I'd request you to see her urgently to diagnose her condition. All right. So if you have any questions on what we have discussed today or about writing, I take a few questions. And do comment how much you have learned from today's session, and I'd be happy to also know about what you think of this class in particular. And as I've told you earlier, you could enroll with one of our trainers if you want a detailed one-on-one training which happens online, or if you are from anywhere in India, you could come to in-classroom training here at Kottayam. So I look forward to your questions about writing. You're welcome, Amira. Thank you very much. I will display Sharon, sure. I hope the last introduction was this. Thank you, Marina. Thank you, San. Thank you very much. Thank you, Dixie Bellingham. Thank you. Vijaya, you can be in touch with one of our student counselors. We'll definitely put you through me. Please note the telephone number. These are Indian numbers. Thank you very much, Patumi, Tinu, Ren. You're welcome. You're welcome. So, thank you very much for having me to teach you and being part of this IRS group class. Jitu, you're welcome. Thank you, everyone, and have a great weekend. The recording would be available on Facebook, OET's official Facebook page, and later in the YouTube channel as well. So, thank you very much for being part of this session and for being so interactive. Good luck with your tests, upcoming tests, and I'll see you on the other side with another OET All Stars session very soon. And hats off to all healthcare professionals who are still putting in a lot of effort to fight the pandemic and keep going. Thank you, everyone.